Good morning, good afternoon, good evening. Welcome to the EMS Safety Foundation webinar. This is our fourth birthday. The EMS Safety Foundation has been around for 4 years now, and we're going to be covering the whole of the National Academies, Transportation Research Board's Safety Systems, Strategies and Solutions Summit today, as well as a little update on a number of other programs, including the RETMobile project. So here we go. For those of you who aren't familiar with the EMS Safety Foundation, it's really there to fill a gap in sharing information, knowledge transfer, practical, operational, interdisciplinary R&D, and also to assist us in identifying and evaluating safety enhancements. Welcome, Jerome Spinato. It's really a mission is that this is a team of like-minded innovators across EMS and medical transport from all sorts of disciplines, as you're about to see, to share that common goal of enhancing the safety of EMS delivery for our patients, providers and the public, and sharing information. So it's basically a think tank and test bed, and those of you who've been involved with us are pretty familiar with that, and a tool to enhance the safety for the delivery of EMS services in a practical, operationally smooth and very cost-efficient manner. We do R&D, and that's rip off and duplicate. We want to avoid reinventing the wheel at all costs. We want to know where the best practices are that we can share knowledge and transfer knowledge from. You're all involved in a webinar right now, real-time interactive webinar technology, and all you need is your laptop and an internet connection, and you can join in. For those of you who are new to the interface, there's just a few brief instructions. Basically, if you want to raise your hand, ask a question, click that button. If you want to speak, click that button. I'll be throwing the mic around for people to speak in just a moment. But we've got a lot to cover today because we're going to do a whole synopsis of the summit. And I know you're all waiting for it. Here's my favorite slide. So you can pick up here. There is a yellow and a blue pen. Choose the blue pen tool, please, and mark on that map where you are. And I will choose purple. And I am here in New York City, right there, I think. So if everybody could do that, it's always nice to know this is truly interactive, and that's what I like so much about this medium. So I think Chris Fitzgerald might still be asleep in Australia, and I'll see what I can do to get him out of bed. He's hoping to join us. Okay. All right. Well, we'll be seeing Chris Fitzgerald shortly. So the other thing is this is being recorded and it will be available for public access in contrast to our usual secure site. This webinar, because of the importance of the National Academies Summit, and the content is going to be available for public access. And just so you know, it is the EMS Safety Foundation's 4th birthday today. And thanks to all your hard work, we've been around for 4 years. We've given birth to a number of fleets of ambulances and hopefully have been able to do a lot to improve the safety of EMS transport for many people, patients, providers and the public. So my thanks to you all, because without all of your work and the hard work it's been, we wouldn't have been around for that long. So thank you everybody. So today we're going to cover a synopsis, a rapid fire synopsis, and done in a manner we've never ever done things before. And it's going to be done in a sort of multimedia manner. So enjoy. We're going to spend some time speaking about the NAMT safety course. I had the privilege of actually being a student in that class this last Saturday, and I can't speak too highly about the quality of the course and the impact that course has had, not only on the individuals that are in the room that I was in, but nationally and globally. And it's a huge credit to the leadership of that course. And I don't think anyone really can overstate how powerful and how practically useful the information is in that course and what a valuable contribution it has made to emergency medical services. So thank you, and we're very honoured to have Glenn Ludtke joining us today. We're going to have a little bit of a chat about some social networking, about eTags and Twitter, a brief word about the iRescue project that's actually had some award-winning work go forwards, and plans for Retmobile and some other activities for this year. So a lot to cover. Now, that's a frozen dinosaur, and it's actually a frozen dinosaur in Alamosa, Colorado, and I feel a bit like a frozen dinosaur. The EMS Safety Foundation might only be 4 years old, but I'm not. And I'm going to tell you a little why I feel like a frozen dinosaur. It was Social Media Week here in New York in January, and I attended. I'm 53. Only 5% of the people at Social Media Week were over 50. Most of them were not. And there's the little segment there, little purple segment of over 50s. They didn't have a category for people older than that. So we're embarking on a new way of communicating, and we sure discussed that at the summit, but I wanted to share that with you. So the National Academies Transportation Research Board held their 3rd EMS Safety Summit on February 29th, 2012 at the Keck Centre. We addressed pretty much key interdisciplinary and applied solutions issues all in one day. And there's lots of information about the summit that's available at the website. We've had 2 other summits, also interdisciplinary, and there's information also at the Objective Safety website that you can have a look at gratis there. So this was a one-day event. A number of us were there. As a matter of fact, 80% of the speakers came from within the Innovation Consortium of the EMS Safety Foundation. It was held in Washington, D.C., and it was simulcast to Baltimore's, where EMS Today Precon was underway, and there was live webinar access globally. There were over 100 live participants, or participants who seemed to be live, across 3 continents, and within the first week, more than 10,000 people around the world have downloaded the handouts. So I'm very grateful for everybody who made the effort to contribute to participating or speaking, and the huge interest globally in the information you put forward is truly remarkable. We tried to answer a bunch of complicated questions. How do we balance the system of safety for the patient, the provider, and the public? What is a safe speed? How many hours are safe before we're impaired? How many hours of EVOC makes the system safer? And what are the costs and risk benefits of simulators, benchmarks with other industries? What are the determinants of system safety? What technologies enhance system safety performance? And what strategies work best reaching out into each generation? And it was open access, and everybody involved in EMS was invited. So those of you who received the email have also received a copy of this document. And this document takes me back to that page that made me feel like that dinosaur. What's on that document are those little coloured things, and they're eTags, and they're a way of communicating with a smartphone. And all you really do is point your smartphone at one of those tags, and your smartphone will give you the audio track right there and then. That was presented at the EMS Summit. So there's 8 tags there, and it's about 8 hours of audio. The little blue links will take you to the handouts. So 2 sides of one piece of paper, and you have a way to actually download all the information in an 8-hour summit. Technology is truly miraculous. So I want to thank all our speakers and participants, both on-site and online, who contributed. Many of you are on the call right now, on this webinar right now, and I think you represent a body of people who are true leaders and have really changed the face of EMS safety. So thank you to you all for all your hard work. So what we have were 8 sections, and the opening address was A.J. Heitman, and the first section was data and recent initiatives. And it looks like Jean's joining us. Hi, Pete Dworsky. The second section was that bridging different disciplines, transport, human factors, culture. The next section was testing and standards. The next section was new systems, safety technology, solution, and telematics. The next was fleet management strategies. The next, innovative vehicle design. The next, operationalizing safety. And the last section was a panel on how to optimize the safety of your existing fleet, and a phenomenal wrap-up, yet again, by Professor Cooper. Now, the intriguing thing is that each one of those tags will take you to the soundtrack of that session's presentations. And as we go through this today, you're going to see that there's an e-tag in the corner of each presentation. And I'm actually going to, once you download Microsoft Tag onto your smartphone, which is there on my smartphone, you can just hit that little scan button in Microsoft Tag, point it at the screen, and abracadabra, the soundtrack for that section will open. Now, that's social media at work, and that's amazing technology. So your handout for this webinar will include these tags. So if you see something that interests you in the handout, you can just point your smartphone at that tag and your smartphone will give you immediately the recording. I think that's just amazing. So here's AJ Heitman, who did the opening address for the 2012 National Academies EMS Safety Systems Strategies and Solutions Summit. And that's where he did it from, in Baltimore, at this beautiful booth set up by GEMS in support of this important event. And those of you who know the trade floor show there, it's a very, very busy place and very active. And that's the GEMS exhibit hall. And here's AJ's favourite vehicle, also on display in the exhibit hall, but that's it in front of AJ's house. And just to show that you don't need lots of room to transport a lot of patients, that's AJ and 3 of his Australian colleagues from Queensland Ambulance Service in the back of that beautiful Cadillac. So here's our speakers again lined up. That's where we were at the National Academies giving our presentations. All presentations were about somewhere between 5 to 15 minutes, all short, sharp presentations. And the first thing that we talked about was communications technologies and the rise and fall of gadgets. And I just want to point out, hi Joe, how are you? I just want to point out this steep curve here, which shows smartphones penetrance over time and overpopulation, and you can see that there has not been a communication modality in the history of mankind that has had such impact on our society. Joe, there's a little hum at the back of your microphone. I might ask you to switch that off. Okay. The other thing is that not only is that technology apparent out in our society, but that technology is popping up in the youth of our society. They're the people that are buying and using those smartphones. The people who are more in the more routine decision-making roles are not only not buying them as much, but they're actually not even using them as much. So we're starting to see that there's a huge, powerful communication and data management tool that is now predominantly in the hands of the young generation. So very interesting situation. So we discussed that a little. I won't spend too much time on it. And then the whole history of social media and the powerful impact that Ronald Ralston described to us in his presentation back in December of the impact of social media in the Oslo bombings and shootings. So we're now in a situation where social media, smartphone technology and emergency services are all coinciding. And here we see a situation where this graph here is time, and this is smartphone navigation devices, and here we see no use of them before 2006. And now we see smartphone navigation devices being used enormously. So we are about to see these technologies having huge impact on us. In the 1980s, that's what we had as a cell phone, and now we have one of these devices, and you can get one of those for as little as $60. In the 1980s, that's what our ambulance looked like, and in 2009, that's what our ambulance looked like. And But now we're looking at ambulances even here in the United States that are based on some of the European designs, have input from automotive safety engineers, and task analysis operational ergonomics. We'll be talking about that all in a lot more detail. So a couple of rules and policies we addressed in the summit: Federal Motor Carrier Safety Administration, November 2011, cell phone use policy, we're going to touch on that, and an hours of service policy. And that's the cell phone ban from 2011. And this is the new hours of service policy. And again, if you just shine your smartphone on that E-tag there, you'll be able to hear that whole presentation. We also covered a number of fleet operation standards, ISO 39001, the ANSI V15, very valuable tool for EMS, and the new vehicle standard from NFPA under development, 1917, about to be released, and some equipment mounting testing standards from the Society of Automotive Engineers for ambulance vehicles. So really, in our opening address, we identified there are improved data systems for identifying injury. There's enhanced data on the denominator. There are new technologies out there to keep us safe, new policies and standards, and clearly an enormous amount of interdisciplinary collaboration. The new safety data not only is the Transportation Research Board, a hugely valuable resource, but we've got the National EMS Assessment data, we've got data from NFPA, we've got the Towards Zero Death EMS section, we've got the NCHRP 1751, some focus on EMS in FARS and also in the minimum model uniform crash criteria so that EMS can be properly represented, as well as NEMSIS and the Bureau of Labour and Statistics. That's the National EMS Assessment document, and that's the NFPA data analysis document. So we were very fortunate to have a representative from the Bureau of Labour and Statistics come and speak with us, and Janice Window gave us an outstanding presentation on the new data that's been captured. And clearly transportation is a major problem, as we know. We're very fortunate, just when we had our summit in 2009, we were told that there was going to be some new data being captured, and the data she presented was hot off the press. And clearly when we look at days away from work, human factors, lifting and moving, loading and unloading are major issues for EMS providers. And a quarter had more than 31 days out of work. So Janice Window did give us her contact information, and I'm sharing that with the world. She's been enormously helpful to EMS, and we're incredibly grateful. Without data, without knowing what's going on, how we're having any issues in the workplace that could cause injury or fatality, it's very hard to find solutions. So her work has been a huge contribution. We're very grateful. We had an update on federal agencies' activities from Eileen Fraser, and there's been a lot of movement. NTSB's shown quite a focus on looking at system safety and emergency services. There's the Mexican Hat report, as well as quite some strong focus on what can the NTSB do to enhance the system safety of emergency services. FEMA, DHS, NIST, NIOSH are all actively involved in working towards interdisciplinary collaboration and improving the safety of the MS environment. NEMSAC has a safety committee, and there was a brief presentation update on their activities, and the CDC has just announced some new triage guidelines. And the DHS, NIST and NIOSH collaboration is working on some survey material that was collected just at the end of 2011. I want to again make some reference. The MS Safety course was presented at the summit, and I was just wondering if I could just ask Glenn Ludke to just say a few words about the course. I have a couple of slides here, Glenn, for you. And if you just have a minute or so to run through those slides with us, I'm going to hand the microphone over to you, Glenn. I'll turn the page for you. Just say next.
Okay, we'll give it a try here. I just, if you didn't get my message, everybody turn your volume way up. This is, for some reason, the best I can do. Well, the program is now almost exactly 1 year old. We rolled the original one out at EMS Today last year in Baltimore in March of 2011. Designed as a one-day program, and it's interactive with the group, between group and instructor. We used case studies as much as possible, but just simply because that's how adult learners learn. And unfortunately, we have enough real incidents to illustrate the points that we need to illustrate. The course is approved for continuing education credit at all levels for EMS, which is valuable obviously to our EMS providers. And it's presented in a series of 8 modules. Go ahead, Lee.
And if you want to actually hear Glenn speak about this with some more clarity, all you have to do is shine your smartphone on that e-tag, and you can hear Glenn give a full 5-minute presentation. But he's going to give us a little quick update just now, and over to you again, Glenn.
Okay, we've done courses at 11 state and national conferences, as well as 214 local and regional courses. That was as of when we met, and obviously there have been more since then. So far we've certified now over 1,500 EMS practitioners, including Nadine, and we have 401 instructors.
That's
who are
right.
certified.
Certified on Saturday.
So we're active right now in 30 states, and you can go ahead with the next slide, if you will. There we go. We're also international. This was our first class in Japan. We rolled the course out there in December, and they're very actively conducting courses right now in Japan, and hope their goal is the Japanese Paramedic Association, which hopes to train the entire country. Our goals for the coming year include getting to the rest of the states that we haven't hit yet. There's also some other international work to be done. We're talking with Israel. We're talking with a couple of other countries about taking the course there, and we're preparing to do a first revision. That revision will occur during 2013, just because this business, as you all know, is a moving target. Things change every day. So if you want any information about the program itself, the information is on the screen. And if you want anything else, you can contact me. And thank you very much for your time.
Thank you so much, Glenn. I can only tell you that it's one thing to say a course is good. It's another thing to actually do the course. And I can tell you that I don't think there's anything out there that has a more practical, more valuable application to really change the face of the whole environment of EMS safety and safety systems. It's a fabulous course. You should all go and do it. Neil and I did it together on Saturday, and I think that if you haven't done the course, I think you're doing yourself and your service an injustice. Everyone in EMS should do that course. It should be an essential part of your training. So again, kudos. It's incredible that you guys have put that together, and it's incredible that you've done it so quickly, and the world is going to be very, 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 very grateful that you have. So thank you, everybody at NAMT, and I will add that NAMT was awarded the EMS Safety Foundation Leadership Award for having put that course together. So thank you, Glenn, and your team. So Eileen Fraser followed after that, giving us a discussion about safety culture, focused on 4 areas: informed culture, just culture, flexible culture, and learning culture. Again, shine your smartphone on the e-tag and you can hear us speak. We had a very brief update on the National EMS Culture of Safety Project, and I'm very pleased to announce that Eileen informed us that in summer 2012, the Commission on the Accreditation of Medical Transport Systems has put together a Safety and Quality in Medical Transport Systems, Creating an Effective Culture, a very valuable document. So we look forward to seeing that. The next session was Bridging Ergonomics, Operational Task Analysis, and Automotive Safety. These topics have attracted huge online interest. over 12,000 people have downloaded handouts pertaining to the summit in its first week. We weren't expecting a tenth of that. This was a fabulous presentation from Gene Lukyanov, who I think might be joining us online but has a connection issue. And he really described the technical relationship between the automotive safety environment and the ergonomics. And I think this is a fabulous summary, bridging the gap, basic principles of ergonomics, maintain health, safety and productivity, basic principles of automotive safety, prevent crashes, minimize consequences, and having those two disciplines working closely together in how we do what we do in EMS is very, very important. Chris Fitzgerald then followed. It's very early in the morning in Australia, and Chris Fitzgerald may be joining us shortly. Daylight savings has kicked in, and it may be that he'll join us shortly. Chris gave us an outstanding presentation discussing the key features of ergonomics, task analysis, what people do, the size of the person, and the mechanics of how bodies move, and then other factors, lighting, usability, cognition, very important elements. And focused on task analysis, understanding the mechanics of what you do. It's one thing to say you've got to take a blood pressure, it's another thing to talk about how you actually do that. He gave us some examples of anthropometry, the study of body size, of our patients, our providers and other occupants, the differences in gender, the functional relationship to task performance and biomechanics, and there's some examples of some sample body sizes there. And then he gave us an example of some work forwarded by Dr. Kathleen Robinette. I had the pleasure of speaking with her online yesterday about gender and body size. These are all predictable measurements that we can use to properly design our environment. And again, when it comes to the interrelationship between ergonomics and automotive safety, forward and rear-facing seating, no side-facing seating whilst the vehicle is in motion, the person should be restrained at all times, and we're going to look at some very clever ways around that. Ronald Rolston, who's online with us from Norway right at this moment, and some design challenges. Again, point your smartphone at that tag and you can actually hear Chris give that presentation. So in summary, effective application of ergonomics can help define the system in a meaningful and useful way. The strategies involve task analysis, anthropometry, functional task performance and biomechanics in the context of automotive safety and occupant protection needs. And the solutions are creative designs that orient the users and the occupants safely, provide your ability to do your work while people and objects are restrained. Our goal after each presenter was to put together systems, strategies and solutions, and I've got to tell you that synopsis there done by Chris Fitzgerald really is a very powerful and valuable statement. Information technology transfer, I spoke to that, and new tools, new collaborations, new platforms, new events, new organizations, and webinars, podcasts, blogs, Skype, Twitter, and e-tags, things, some of which we didn't even know about when the foundation was put together. There's an increasing focus. The Transportation Research Board of the National Academies has really provided an enormous service to the EMS community, and we have Rick Payne's vision to thank for that. We're going to hear a little more about RITA, ITS, Intelligent Transportation Systems, and the DOT. The Traffic Records Forum has been very supportive of EMS safety. Department of Homeland Security, NIST and NIOSH working together to identify how we do the work that we do and how best to design our environment. The Traffic Incident Management have their own network which is there to look at the safety of those providers. American Society of Safety Engineers, the Society of Automotive Engineers, and us here at the EMS Safety Foundation. 80% of the speakers at the National Academies Summit were people who were involved in the EMS Safety Foundation. Kudos to you all. Places like Retmobile where we can share international information. We were very, very honoured to be given our own booth last year at Retmobile and to be recognised on their website for the work that we're doing as a group. So thank you, Retmobile. We'll be there very soon, and we're going to be talking to folks about our Retmobile delegation. It's going to be a bumper year. We're going to have Ronald Rolston's vehicle from Norway for a live workshop, and we'll have another 3 workshops there to make 4 workshops all up. So we look forward to seeing you in Retmobile. Thank you very much. So in summary, collaboration is key, but it's got to be interdisciplinary, interagency, and international. The next section, which sure has created a lot of interest online, was the section on vehicle and fleet and vehicle standards. We talked about some fleet standards, the exemptions from federal motor carriers, the valuable ANSI ASSE Z15, the up-and-coming ISO, and then went through the sort of rubric and fabric of the vehicle standards, whether it's the AMD and KKK, which are being merged and blended into their NFPA document, which is almost ready for release, and ASTM, the exemptions from FMVSS, the Federal Motor Vehicle Safety Standards, and the new equipment restraint standards from the Society of Automotive Engineering, and some comments about the international. Please go to the Federal Motor Carrier Safety Administration website. There's a lot of valuable information regarding fleet management. Here's an image of the ANSI standard. Again, a huge contribution. Safe practices for fleet motor vehicle operations. And the NFPA 1917 that a number of us have been involved in. And we'll have some time for questions right at the end, but we've got a very tight time frame here. This is the Society for Automotive Engineers' new ambulance equipment mounting test standards. Again, these are testing standards for the mounting of equipment, the brackets and securing those. These are not deforming intrusion standards for the actual vehicle. And we had a discussion. Put your smartphone on the e-tag and you can hear a discussion about the different types of testing. We talked about deceleration sled tests, barrier tests, full vehicle-to-vehicle tests, and computer predictive modeling. And it was a very brief nutshell on what do all these different types of testing mean. And we spoke briefly about the 2 international standards that have been in existence since 1999, put together in a very different format than NFPA 1917, basically came through the sort of more routine automotive safety channels. We then had the luxury of having Gene Lukyanov present a very helpful overview. Gene's an automotive engineer, automotive safety engineer, and he went through all the different types of testing that occurs for automotive vehicles, medium trucks and ambulances, and compared it all for us. Described some background information about these different documents, and then described how they interact with the new NFPA and the ASTM standard. Very helpful and insightful presentation. We then had a wonderful presentation from Jim Augustine on dispatch systems, basically from the most basic to the most sophisticated, and really in a very brief window of time covered the key issues in actually a most thoughtful and insightful manner. And please do put your smartphone on that tag there and listen to Jim Augustine's presentation. He really, in a nutshell, covered the key issues that we're faced with in the dispatch side of EMS. Unpredictable callers, time limitations, issues now that we have with locating calls, the challenges of mobile phones, and also the challenges of social media, which is now, there are a number of services that are monitoring social media around the United States and internationally in order to have a heads up. And Ronald Rolston gave us a phenomenal presentation on that. So a bunch of solutions there that will assist in getting the right resource to the right place. Thank you very much to Jim Augustine. We then had a fabulous presentation on the cutting edge of intelligent transportation technologies from the ITS Joint Program Office at DOT. There's a program called Rescue Me. Someone needs to get brownie points for that one. Response, emergency staging, communications, uniform management and evacuation is being put together as we speak, and we were very fortunate to have Linda Dodge, who's leading that project, give us an update on that. Next Generation 911, mobility programs, traffic incident management, and the ITS program background. So please do take a listen to that. Again, just point your smartphone at that e-tag and you'll be able to hear Linda give that fabulous 10-minute presentation. As I said, we kept the presentations to 5 to 10 minutes in order to make sure that everybody would be able to get a lot of information quickly. Here's an overview of the Intelligent Transportation Systems Research Project at DOT, and I'll leave it to Linda to explain that on her ETAG presentation. She also covered the development of Next Generation 911. Clearly, there's enormous interest in keeping ahead of this rapidly developing curve, and you're going to see the whole concept of smartphone, cellular phone, social media running through this whole summit. If you would like some more information, Linda has provided her contact number and her email address and website. So please don't hesitate to reach out for more information. She's a phenomenal resource and a fabulous speaker. We were then most fortunate to have Matt Crossman give us a presentation from Canada, from Prince Edward Island, about an experience they had with their Code 1 speed restriction policy, and he described what they went through and how they addressed it and what the lessons learned. And it sure ended up in the news at the outset, and also when the arbitration decision was in their favour, it was back in the news again. And their solution was better communication at the outset to stakeholders, staff and members of the public, education on the risks of vehicle safety, system solutions, not just a policy, and really remember when this was just normal practice to be speeding around. So please take a listen to that 10 minutes from Matt Crossman. It was a fabulous presentation. We were then extremely fortunate to have Nancy Bendixson from Aon Insurers present. She was beamed in from Minneapolis. And Nancy's had extensive experience in fleet management and fleet system safety. She spoke to us on the issue of impaired and distracted driving and hours of service, and highlighted that impairment isn't just drugs and alcohol, it's fatigue and distraction. And I think many of us in emergency services are very familiar with the challenges of fatigue and distraction as we do our work. And a lot to learn from Federal Motor Carriers Safety Administration, the railways, transit and DOT on hours of service, and distracted driving is becoming a major issue. Again, the smartphone is there. Distracted driving is 4 times worse if you're using a handheld phone, but if you attempt to text and drive, you are exacerbating the hazard and danger 23-fold. So a cell phone's like being drunk. Texting is far worse. So I think very valuable information and a fabulous presentation from Nancy Bendixson. She highlighted 4 dimensions in which distraction occurs, and that often the distraction is occurring in all 4 dimensions at once. She covered some of the DOT hours of service rules, and again the information we presented right at the start from the new regulations for Federal Motor Carriers are very valuable. Do take a listen to Nancy, point your smartphone at the ETAG. So basically the systems approach is evaluate your level of fleet safety systems in your service, fatigue management, driver fitness and focused driving. What strategies can you use? Increase your focus on fleet safety to the same level as patient and employee safety. And solutions are audits, perception surveys to address behaviour change at all levels in the organisation, and education and the use of technology. A phenomenal presentation, getting that volume of information into a short talk. It was fabulous. So we move on to look at some of the technologies that are out there. A lot is now possible and for less. We can look at driver behaviour, vehicle behaviour, roadside intelligent technologies, fuel consumption, economics and resource modelling in a way that was never possible. We've got a stack of technologies out there, and we had wonderful presentations from a number of folks who are using these technologies, from the Ace Texferno product, Fleet Eyes from Intermedics, the Zoll RescueNet and Road Safety Fleet Management Systems, Marvelous, Telematicus, a very innovative product, software product that actually turns your smartphone into a road safety device. So you can't talk and text, but it actually gives you driving feedback and maps your driving. Optima have a number of products, as do Northrop Grumman. So we covered a bunch of those. There's a spectrum of dimensions, whether it's computer-aided dispatch, resource allocation, fleet performance, monitoring and feedback, and we even heard about ETA 911, a public alert system. Very interesting product. Do have a listen to those. Ron Thackeray from AMR presented their fleet safety solutions that they use. Again, point your smartphone at that E-tag. He gave a fabulous presentation. Identified monthly driver reports that identify high-risk behaviours, real-time driver feedback, and reports for employee evaluation. Charlene Cobb gave us a great presentation from Sunstar. And in one simple chart here, you can see, just looking at unsafe reverses, what an impact that program's had. So kudos to Charlene Cobb and Sunstar paramedics. And here's how their system actually looks. And we may have some moments for questions at the end. I know Charlene has to leave right now. She may have already had to leave. So if you've got any questions, do forward them on to us and we'll get them to Charlene. So basically, it was possible to realize a dramatic change towards safety. We had evidence providing that drivers were doing better, and we're able to identify drivers that weren't prepared to do better. John Kinane from Niagara presented a fabulous presentation on the new ACETEC Integrated Vehicle Intelligence System, the safety systems of it, the EcoRun module, and the asset protection benefits. Again, a short but very info-packed 10-minute presentation. Point your smartphone at the E-tag and you can hear John give that presentation. Those E-tags will be printed on your handout that you can download. You can actually point your smartphone at the computer screen right now, but I'll make sure that those E-tags are on all your handouts so you can hear the presentation from your handout. The system really created a much safer system for them. And John presented some impressive data of a dramatic and sustained improvement in speed management. We then had a great presentation from Jim Schwartz, beamed in from Dallas, Texas. Jim is a real forward thinker and a visionary. He has taken the philosophy of the EMS Safety Foundation to heart and has rapidly implemented the principles put forward by the engineering folks and the ergonomists to build his new fleet. He built them into the Sprinter ambulances, and forward and rear safe seating were critical, able to reach the patients from belted positions, and leadership, communicating, and culture were very crucial, very much important to have a systems approach, not just a vehicle, and to be science and data based. And here's some interiors of those vehicles, and he made sure that those vehicles were implementable in Texas, no mean feat. And you can see that the seats here are the European style seating that flips back against the wall, but once you're underway, flip forwards, so there's no side-facing occupants. And he also shared with us some of his safety culture posters, and I am going to let you download the handouts to see those in the interest of time. We had a great presentation on some alternative fleet vehicles, and motorcycle medics were presented by Fran Menzel. And I think one of the most powerful statements, a number of the research was presented, was this fabulous paper from Norway, and where the motorcycle missions were able to prevent the deployment of a ground vehicle. And I actually had the privilege of attending a lecture given by these gentlemen who actually rode the motorcycles right into the lecture hall, and I'm assured that won't be happening at the Keck Centre. This vehicle recently published in a journal on looking at ergonomics. This is actually a very creative and interesting design from the Texas Transportation Institute. And again, I think creative thinking is what's the goal. We then had a presentation from Chris Fitzgerald. Many thousands of people have downloaded this handout specifically. He covered the systems approach to the safety of the design of an ambulance environment, seating beside the patient, forward-facing seats, forward and rear-facing seating, avoiding sidewards once you're underway, restrained paramedic, and ensuring the paramedic has access to their equipment, and that head impact zones are either avoided or minimised. At the head end of the patient, you want to be either forward or refacing, restrained, and again minimise head impact. And here we see Chris Fitzgerald here. Actually, this is a live webinar from Retmobile, and this is Ronald Rolfson seated in the Norwegian ambulance. And we're going to look at a couple of those features in a presentation I gave shortly after. Ronald may be able to contribute to that, although we're pushing for time right now. So effective application of ergonomics can help define the system in a meaningful and useful way. We discussed this before, how it's extremely important to interface with automotive safety, and that creative designs provide your ability to do your work and to be restrained. We're going to look at some of those. I gave a very brief presentation and update on PEDS and neonates, special population, unique challenges, potential pitfalls that we see in some solutions that people are putting forward, and some innovative approaches in the United States and internationally. The important take-home is that it is a system. It's a child in a vehicle with other occupants and equipment. Anything you do to change that configuration is going to change the safety of the system. It's a vehicle that's in a fleet of vehicles, and it's a fleet in a region, and that whole system needs to be considered. Here's an example of some work by Chris Fitzgerald in Australia in their paediatric and neonatal transport unit. And as you can see, the seating is forward-facing. When the vehicle is stationary, you can turn side-facing should you need to, but there's pretty good access to that child there in that setting. So they can actually transport 2 patients in this configuration, and that's done in a Sprinter, standard Sprinter. This is a great vehicle. We have Jerome Spinato online. Jerome was in the Ukraine whilst we did the summit. Jerome, if you're able to stay online, we may have a few moments for questions later. This is a fabulous vehicle designed by the team there, incorporating input from automotive safety and ergonomists. Those seats will fold down forwards so that you're actually able to load on a second stretcher if you need to, and we're going to have a lot more discussion about that anon. Here we see the Norwegian vehicle. We actually have Ronald Rolfson online. Ronald was unable to make it to Washington, unfortunately, due to pneumonia. This is his vehicle, and the focus is on safety. And again, if you want to hear the presentation that we gave, by all means scan the tag, and the document right at the start had a tag to scan for all the handouts. Important to have a crash-worthy vehicle, seatbelt pretensioners, and internal passive safety, impact zones, no sharp edges. And a very impressive feature, and there are many impressive features, what you need to reach for is on your right-hand side. In so many of the vehicles in the United States and elsewhere, what you reach for is on the other side of the patient. So all necessary equipment was in reach. And this is a fabulous feature here. The provider is secured, but the stretcher is on a track. So you can move that stretcher closer to the provider for an airway issue, or if you happen to be the provider over here and you don't have a provider there, if the patient becomes combative, you can just stomp on this little switch here and you can move the patient out of your zone of safety. Eileen Fraser then gave us a very quick presentation on what Air Medical can teach us. It can teach us policies and practices for safety. It can teach us to learn from our mistakes. It can teach us fatigue mitigation, safety management systems, and then AMRM, which is Air Medical Resource Management. Crew resource management specific to air crews includes communication and processes and decision behaviour briefings, inquiry and advocacy assertion, crew self-critique and conflict resolution, team building and maintenance, and workload management and situational awareness. Please take a listen to that presentation from Eileen. It was outstanding. So yes, we can learn from each other, ground and air. We are moving while caring for patients. Safety vigilance for ground is just as important as it is for air. We also need to have greater data for ground incidents and accidents and crashes in one strategic location so we can track, trend and analyse as we do for air crashes and mitigate risks and hazards. We had a wonderful presentation from Carol Cunningham, and she identified untapped opportunities focusing on a number of areas including resource utilisation, making sure that we get the right resources to the right place in the right way, and highlighted some of the tools that we have, untapped opportunities for resource allocation. Please put your smartphone on that e-tag and have a listen to Carol's 10 minutes. It was fabulous. And she wrapped up with that EMS is on an island. We must have data. We must do what we know works. We must actualize what we know. We know that using restraints makes the situation safer for providers. We've already seen some creative designs that makes it easier for us to do that. And we also need to have EMS included in traffic incident management plans and drills. We then had yet another fabulous presentation from Dear Gaynor, looking at the relative benefit, covered many issues including data sharing, predictors of injury severity, mobile apps, route selection and guidance. And please put your smartphone on that e-tag and listen to Dear. I love this slide, the Model Inventory of Emergency Care Elements, MIECE, the MICE program. Now those of us that use Google Maps and traffic are familiar with the green, yellow and red, but these aren't for traffic. These are green, yellow and red zones for level of emergency care resources available. Red, low level of emergency care resources. Yellow, medium level. Green, high level. How fabulous would that be? And I think this sort of innovation is exactly where we're heading now. We have technologies that can help us do this, and these can be fabulous guides on how to get the best care in the best way to the people that need it. And Dear highlighted how we need to improve the transportation mode of EMS. We need to improve outcomes for patients with time-urgent conditions. We need to use the tools that are out there, and we need to do what we can to counterbalance the rural disparity. We then had a panel, and it was a great discussion. A hand-picked group of people, including policy people, automotive engineer, an ergonomist, an operational EMS person, a medical director, and an ambulance builder, and a researcher. And the question that we had to answer was, as you'll hear if you point your smartphone at that e-tag, was you have a fleet of 5 vehicles, and they're the standard 5 vehicle types that you see. What are you going to do to optimize the safety of that fleet? And each participant had 2 minutes to share their thoughts. Clearly that's something we're going to be doing in a more extended fashion. And probably, although all was valuable, the most valuable part of our summit, I believe, is the presentation given by Professor Arthur Cooper. Arthur Cooper managed, we've struggled to do this in about 50 minutes. Arthur Cooper managed to sum the total summit up in a mere 10 minutes. And he ran through what it all means. Please listen to session 8. Session 8 does include the panel discussion and Art Cooper's wrap-up, accessible from that tag. So what is old in EMS safety? Well, we have old equipment and inadequate funding. We don't have enough training, and we've always done it this way. What's new? Exponential growth in teleinformatics. We now have better vehicles which are cheaper. We have systems engineering. We have an increased awareness of safety culture. What can we do now? We can decide which calls really do need a hot response. Some of these simulators that we're using may help to identify how best to use our resources, such as Marvelous. How much time do lights and sirens really save us? You know, some data is out there telling us that not a lot. And has anyone done a true cost-benefit analysis of lights and sirens use, looking at the full spectrum, lives saved and lost? And which patients are eligible for treat and release? 25 to 30% of our patients don't get transported. So in summary, Professor Cooper stated there are systems issues, physical factors and human factors that we can use to our advantage. Data, information and technical know-how. There are strategies, imagination and innovation, leadership and followership. And there are some solutions in vehicles, ergonomics, informatics and telematics. So we were very pleased. The next day, off to EMS Today, and we spent 2 days talking to people about the summit. I couldn't possibly wrap up without making a formal thank you to Kyle Bates from First Few Moments. It was thanks to Kyle that our satellite site at MS Today ran so smoothly, and that everything ran very smoothly for the rest of our EMS Today experience. Hundreds of people came by to hear about this information. So a big thank you to Kyle Bates. Kyle also gave us great support at RepMobile last year and will be joining us at RepMobile this year. So stand by for his podcast and our video. So a couple of things I want to wrap up with. I've been able to somehow or other keep us on time. Objective Safety and the EMS Safety Foundation are on Twitter. For those of you who don't do Twitter, all you've got to do is just click on that link on the home page, and there it is on the EMS Safety Foundation page. Just click on that and it will walk you through. Please follow us on Twitter. We can get information out to you really quickly that way. I also want to make specific mention to a project that has been underway under the umbrella of the EMS Safety Foundation, and I'd like to thank our sponsors, Zoll, Cardiac Science, Furno International, and Defib Tech, and the Sudden Cardiac Arrest Foundation, and the Women's Heart Foundation. For the awards, we had a record-breaking result from our first two defibrillator scavenger hunts, and this is Linda Cotter Forbes, whose daughters had survived a sudden cardiac arrest, who set a world record in finding defibrillators using our iRescue social media approach. And there's the Defib Tech Award being presented to her. RepMobile's coming up. For those of you who are joining us, it's time to start getting your air flights organised. Air tickets just dropped this week, so it should be a little more cost effective. RepMobile 2012 is May 9th to 11th. Our delegation starts on the 8th. We will be having the Ronald Rolston's fleet with us. There's your sign-up link for those of you who are in the Foundation. For those of you who would like to participate and are not members of the EMS Safety Foundation, there's a link for you on the website. Please let us know. That's what it looks like. It's a huge event, massive. And there's our booth last year, and Professor Sefrin and Dr. Heidi Cordy in the foreground, Chris Fitzgerald in the background, and there's Kyle Bates, who was running podcasts from there. And that's the Delui booth, who have been very supportive of our initiatives, particularly Anna Shower and the Delui leadership. So by all means, take a listen to the webinar that we did from RepMobile 2011. That's public access off the EMS Safety Foundation website. And there's some of those ambulance vehicles in the parking lot there, and that's one of our workshops at RepMobile. So we've managed to finish with a few minutes left for questions. We will be also doing a workshop on the last Friday of MS Expo at New Orleans. So pen that one in. We will have a vehicle and it'll be a hands-on workshop on that occasion. So without further ado, we've managed to finish on time and we have some time for questions. So if anyone has a question, could you please raise your hand? I'll be having the recording and the handout posted for public access, and those e-tags on the handout will give you a direct link to the audio track for each of the 8 sessions. So if anyone's got any questions, please don't hesitate to ask. As I mentioned at the start, it is the EMS Safety Foundation's 4th birthday today. It's thanks to all of you that we've been doing this work for 4 years, and I personally want to thank everybody for their hard work, particularly those who've been recognized by the Foundation with Foundation Awards for their commitment to making the environment safer for everyone. So if we have another 2 minutes left for any questions, and in that 2 minutes while we're waiting for questions, I would like to also reiterate, please do the NAEMT safety course. It's fabulous. Myself and Neil Blackington were both certified on Saturday in New York. Compliments of the leadership at Long Island Jewish Hospital. And it's a great course. It works. Doesn't matter what stage of EMS you're at or what title or what role. There's a take-home for everyone in that course. Congratulations to the NAEMT and particularly the leadership of Glenn Ludke for making that course happen, and to his team. Thank you, everyone. So Denver in June, maybe Chet. We'll see. I might get there in June. It's a busy year this year for a bunch of reasons. Any folks got any questions that you'd like to ask? Because I'm going to wrap the recording up in 1 minute. I want to just thank also all our speakers for the TRB Summit. I particularly want to thank Rick Payne and the folks at the Keck Centre for making it possible for us to do that. And thank you, Ronald, for your amazing support. And for those of you who have not yet heard Ronald's presentation on the Oslo situation in last year, the Oslo tragedy, please take a listen to Ronald's presentation on that. It's a phenomenal overview of emergency response. So without further ado, it's right on 3 o'clock. I've taken an hour of your time. I want to thank everybody for all their hard work and their commitment. I wish you a safe year. I look forward to seeing you either in Retmobile or online or at EMS Expo. Thank you everybody for all your hard work, and look forward to seeing you online or in person soon. In order to do the recording, if you could sign yourselves out so I can get the recording out to you as soon as possible. So good afternoon, good evening, and good morning, and thank you.